of the House of Commons Standing Committee on Health. Today's meeting is taking place in a hybrid format pursuant to the standing orders. In accordance with our routine motion, I'm informing the committee that all remote participants have completed the required connection tests in advance of the meeting. Pursuant to Standing Order 108 Sub 2, the committee is studying the subject matter of Supplementary Estimate C 2023-2024, Vote 1C under the Canadian Food Inspection Agency, Vote 5C under Canadian Institutes of Health Research, Votes 1C and 10C under the Department of Health, and Vote 10C under Public Health Agency of Canada. I'd like to welcome our first panel of witnesses. Joining us for the first hour, the Honourable Mark Holland, Minister of Health, as well a welcome to the officials accompanying him today. From the Canadian Food Inspection Agency, Diane Allen, Associate Vice President, Policy and Programs. From the Canadian Institutes of Health Research, Catherine McLeod, Acting President, Jimmy Fecteau, Chief Financial Officer, and from the Department of Health, Dr. Stephen Lucas, Deputy Minister, Eric Costin, Associate Deputy Minister, Michelle Boudreau, Associate Assistant Deputy Minister, Strategic Policy Branch, Karen Stewart, Director General, Resource Management and Advisory Services Directorate, and from the Public Health Agency of Canada, Heather Jeffrey, President, and Martin Crumans, Vice President and Chief Financial Officer. There's such a vast number of officials here in support of the Minister that not all are seated at the table, but if any are required to respond to one of the questions that are posed by members of Parliament, they'll simply approach the table. So with that, by way of introduction, we welcome Minister Holland and invite him to make his opening remarks for up to 5 minutes. So welcome, Minister. You have the floor.
Thank you so much, Mr. Chair. It's a pleasure to be back before the committee. In this instance, to address Supplementary Estimate C. I would be remiss if I didn't start by thanking Dr. Stephen Lucas. Many of you will have heard that Dr. Lucas is retiring. And Dr. Lucas's incredible leadership is a massive part of why we had the incredible pandemic response that we had. He leads an extraordinary team of officials, and it has been my extraordinary pleasure over these last 8 months to work alongside with him. He will be sorely missed, but on behalf of all Canadians, I want to thank him profoundly for his contributions to our country and to health. And colleagues, I come at a time where we're seeing fantastic things happen in our healthcare system. Just this week, I started it on Monday with Everett Henley in Saskatchewan, announcing our shared commitment to work together on healthcare with a health agreement that covered both aging with dignity and working together, tackling the challenges and the crisis that we have in primary care by setting aside partisan differences. Focusing on what we have in common and, frankly, getting things done for Canadians. That's 10 bilateral agreements that have been already announced across the country. Well, actually, many more, because some of them are aging with dignity and some of them are working together. In totality, they will be 26 agreements. And next week, I'm going to be having an opportunity, you've heard the agreement in principle with Quebec, to be finalizing that. And that's part of our $200 billion commitment to the Canadian healthcare system. To make sure that where we already have one of the best healthcare systems, and we just saw something, in fact, just a couple of weeks ago saying that we're the #2 healthcare system in the world, to have an opportunity to be head and shoulders the best healthcare system in the world. But it's not enough to tackle the crisis of the now, whether or not it's in aging with dignity or in dealing with workforce issues. We're also looking at preventative care and going upstream. Over 1.5 million seniors have signed on for the Canadian Dental Care Plan. And so we're super excited to see such an incredible rate of participation. And I can say that as I go across the country and meet with hygienists and dentists and with denturists, that it's phenomenal to see so many signing up, getting ready to serve people in many instances who've never seen an oral health professional. And of course, how can we have the best healthcare system in the world if 25% of our population doesn't have access to oral health? So we continue to move forward on dental care. I'm also exceptionally pleased, and I see Don Davies on the screen, to have worked very closely with Don. There was a lot of difficult negotiations, and I want to thank all parliamentary colleagues and Sonia for, particularly on the diabetes side. We were able to announce the first steps towards a national pharmacare plan. And we're starting with universal contraception and diabetes drugs. Now, I just want to talk for a minute about how significant that is. On universal contraception, this means that no woman anywhere in the country will have to worry about whether or not she has access to the reproductive medicine that she needs to have autonomy over her own body. It means that wherever somebody is, they are in control of their body, their sexuality, and their reproductive future. That's not only important as a matter of direct application, it's essential to broadcast as a message about sexual health in this country. That sexual health is health, that we need to be able to have conversations about sexual health in the same way that we have conversations about any other aspect of health. And I hope that it starts a conversation around sexual shame and what we need to do to ensure that people are able to freely be themselves in this country. On diabetes medication, it's going to mean, and I could give you an example in an Ottawa clinic, going in and speaking to a nurse in a diabetes clinic who says, I'm watching patients reuse syringes, watching patients who can't afford their medicine, which means that they wind up in a situation where they have an amputation. That shouldn't be happening in this country. So I'm so deeply proud that we were able to work in a cross-partisan way to do something that will so significantly impact the lives of so many. And it is in that cross-partisan spirit, I hope that we meet here today to have important deliberations about how we can serve Canadians and their health. Thank you, Mr. Chair.
Thank you, Minister. We're now going to proceed with rounds of questions, starting with the Conservatives. Dr. Ellis for 6 minutes, please.
Well, thank you very much, Chair, and Dr. Lucas, thank you for your service to this country. We all appreciate it, and we wish you well in your retirement as well. Fabulous. Chair, through you, if I could, Minister, who is the minister in charge and responsible, I'll use that term perhaps better, for the Public Health Agency of Canada?
That would be me.
That would be you. Excellent. When was the first red flag raised about the two scientists at the National Microbiology Lab in Winnipeg?
Well, the first time that it would have come to my attention would have been as a parliamentarian, going back to the debates we had in the House. At the time, I would have been whip. Of course, government House leader is...
Just the date, Minister. I don't need a story.
I wouldn't recall the exact date. It would have been around that period of time when it was, 2018, 2019, that kind of time. I was a parliamentarian. I was a whip at the time.
So what you're telling this committee is that before that time there were no red flags raised about two scientists at the National Microbiology Lab who turned out to probably and most likely be foreign agents.
Well, no, I was saying at the time, that's when it came to my attention, I was the whip. If you'll indulge me, I can turn to Heather Jeffrey, who can tell from a PHAC perspective.
Just a date, please, Ms. Jeffrey.
The first concerns were raised in September, October 2018.
September, October 2018. And was it the discovery of the DSO of a patent registered in China that raised that red flag, or what was the cause of that, Minister?
Well, again, I'll turn it to...
You really have no clue.
Well, no. First of all...
Okay, thank you very much. Ms. Jeffrey, what's the answer to that? Was it the discovery of the patent?
Yes, Mr. Chair, that was the first evidence.
Very good. When we look at that, it's interesting, though, isn't it, that China requested samples to the Wuhan Institute of Virology, and then the day after that, is it not true that Dr. Chu then traveled to China?
Look, I think that at the time,
I didn't ask you about what time it was. I asked you, is it true that the
Well, it
Wuhan
depends on whether or not
Institute,
you want an answer.
Excuse me, Minister, please.
I appreciate that you
Wuhan
have a line
Institute
of questioning that you want to, but if
Chair,
I'm not able
is
to
this
answer...
the type of answer that we're going to
Okay,
get
well,
from
I'm
the
not able to
minister
answer
as
his
we did
question in the
before
time
with
that has
this
been
continuous interrupting
I'm not
from
able to
him,
answer the question
knowing
in the
that
time
full well
provided.
it's my time to ask questions and not his? Is that what we're going to have here today, Chair?
Go ahead with your question, Dr.
Thank you very
Ellis.
much.
Please let him finish his question, Minister.
So is it the day after that the Wuhan Institute of Virology asked for samples that then this agency run by yourself, you clearly admit that, then allowed a scientist to go to that actual Institute of Virology? Is that true or not?
Well, I disagree with your characterization, and if given the opportunity, and clearly I'm not, I would be able to provide context and be able to answer your question. But
Well, it's a
I'm
very
not,
simple question.
But I disagree with the way you're characterizing the information, and I don't think it's a fair either reflection of
You know
the
what?
circumstance.
Okay, how about this
or-
then, Minister? Think about this. Red flags were raised. The Wuhan Institute of Virology asked for samples of perhaps two of the most dangerous pathogens in the world, Ebola and Henipavirus. And then a scientist from a lab under your direction then went to China. Is that true or not?
What is true
Are
is
the,
that
are the
two-
facts there or not?
What is true is that at that moment in time, we were collaborating with China on, viruses like Ebola. It was part of an international effort to try to ensure human safety. And two Canadians,
Minister,
the two
then
Canadians
you think
that you're
it's
referring
okay
to,
for a scientist who has red flag raised in their activities to then travel to a place who has requested dangerous pathogens from our lab? You think
I don't
that's
think
okay?
it's okay that the two Canadian
Well, you're
citizens.
justifying it. Is it okay or not?
I'm saying that the two Canadians that you're referring to, who are eminent scientists, who are well published in North America,
Through you, Chair. Minister, they're eminent scientists.
I'm
Where
sorry,
are they now?
Mr. Chair.
Where are
I
they
don't
now?
understand how this works. Am I
This
given
is
afforded the
ridiculous.
opportunity to speak, or is this?
No, this is absolutely ridiculous. Where are those two scientists now, Minister? Where are they?
So,
Where are
again, okay, look, I don't have no idea where the two
You have
scientists
no idea?
are.
Do you
of
not
course,
read
I
the
don't. I don't track
newspaper?
them. I don't suspect that you know. That's the job of the RCMP. I'm not law enforcement, but
Oh, so,
but
okay,
I
very
think
well.
if you would
don't know
afford me
answer
the
to my
opportunity to
question.
speak,
Are they living under assumed names at the current time?
Look, there's a mirror over there if you want to talk to it. If you're interested in talking to me,
You know
afford
what? I
me the
don't need your
opportunity
smart
to
mouth
speak.
answers. What I need is you to answer the questions that I'm asking you, not your smart aleck answers. Are we going to
so
see the
far,
bombast that we
with
had
all
from
due
you
respect,
last
Mr.
time?
Chair, I have
and your
been- I've
petulant
been afforded
behavior?
no
Is that
more
what
than-
we're going to see?
I've been not able to get a sentence out without interruption.
Well, you refuse to answer the questions, Minister. That's your problem.
that's your interpretation, and you're welcome
no,
to
that's
it. But
the truth.
But not allowing me to speak,
So, Minister,
I don't
where
understand.
are those two scientists now? Where are they? Do you know or not? Simple.
Rightfully, it matters as to where they are in an investigation.
No,
It is
do
a
you
matter
know
for
or
law
not?
enforcement,
What's
not
the
for a
answer to the
minister of health.
question?
A minister of health is not responsible for law
Do
enforcement.
you know or do you not?
Why would I know where they are?
So the answer then is no, you have no clue.
Why would I have any clue where they are?
Right, you have no clue. That's very clear. Do you know that they're living under assumed names in China?
Look,
Yes or no? These are simple questions. Do you know or do you not?
I'm not involved with law enforcement.
I didn't ask you if you're involved with law enforcement.
I don't know what you're getting at. I don't have
I
any
never
involvement
asked you if you
with
knew what I
law
was getting at.
enforcement.
What I asked you is, do you know that these two scientists are living under assumed names in China? Do you know or not?
I have heard media reports that might be the case, but I am not involved in law
So you
enforcement,
really
and it
have
is
no
not up
idea.
to me
Very
to
well.
assert the
then-
veracity
That's your time,
or whether
Dr.
or not
Ellis.
those statement is true.
If it's my
I think
time,
it's a
then
fundamental
his time as well,
misunderstanding
so
of
he could
the
turn his
role of a
microphone
minister
off.
of the
That
Crown.
would be excellent.
Yeah, thank you. Next, Ms. Sidhu, please, for 6 minutes.
Thank you, Minister and officials, to being here. And thank you, Dr. Lucas, for your great service. Minister, my first question is about diabetes. As you know, one of the most common chronic diseases affecting Canadians. Approximately millions of people in Canada are living with this disease. And our government has already taken steps forward with the introduction of a national framework for diabetes in Canada. Can you lay out how the new pharmacare legislation continues this work and impacts Canadians living with diabetes?
Thank you very much, MP Sidhu. And I want to start by saying that we wouldn't be here without your advocacy. Your incredible work in the space of diabetes is deeply appreciated. I've been having really exceptional conversations with all provincial and territorial health ministers around how we can work together Set aside the differences that we have. This is about patients. This is about making sure that patients get the medicine that they need and the devices and apparatus that they need. And so this is universal in nature. It means that it'll be blind to somebody's age, and it will mean in every instance that folks have the medicine that they require. And I think it's important to acknowledge that I think this is going to save an absolutely huge amount of money. I mean, forget about the fact that the illness it's going to save. The instances of other illness. I was with heart and stroke, and how tragic it was to see improperly managed diabetes manifest in cardiovascular events, or for it to manifest in so many other maladies. To prevent that loss of limb, is phenomenally powerful. And so, and on the apparatus side, people shouldn't be forced to make a decision about whether or not they reuse a syringe, or whether or not they're going to be able to monitor their, manage their illness or pay for their groceries. So I want to thank you for your advocacy, and I think this is an extraordinarily important initiative.
Thank you, Minister. My next question is, long-term care homes were hit incredibly hard by the pandemic, and highlighted systemic challenges that must be addressed. And I know you're working on that, and it has been working to sign Aging at Dignity bilateral agreement with all provinces and territories. With 6 already announced, can you please share what work has been done on this so far?
Well, thank you so much, MP Sidhu. And there is, with these Aging with Dignity agreements, an opportunity to collaborate with provinces, to work with provinces within their own jurisdiction to look at the unique challenges and problems that exist there. In the first order, we want folks to be able to age at home and be able to get the access to the services and care that they need at home. And in the second order, we want them to be able to stay within their own community. One of the things that's exceptionally difficult to hear is folks who have to leave their home community and go somewhere completely foreign after a life of making contributions to their community because care isn't available locally. So by working with provinces, we're increasing services in the first order to help people age at home, and in the second order to make sure that we have the facilities like long-term care facilities to have people age in their communities. It's also in addition to the work that we're doing on health workforce to make sure that we have the doctors, the nurses, the nurse practitioners, the personal support care workers, and the oral health professionals, and now with our dental care to make sure that people have the full suite of care that they need for seniors who've made a lifetime of contributions.
Thank you. And my next question is, you said no women left behind when they're thinking about their sexual health. Sexual and reproductive health is health. Access to contraceptive and sexual health services is imperative. However, we know that too many Canadians cannot access the medication and services they need. Can you please speak to the pharmacist legislation that you tabled and why you started the universal access to contraceptive for Canadians?
Well, there's a lot of talk about freedom, but freedom over your own body, freedom over your own sexual health, freedom over somebody else telling you what you should or should not do with your body is perhaps one of the most fundamental freedoms that we could talk about. In making sure that every woman everywhere in this country has the access under their own recognizance to be able to get the reproductive medicines that they need to take charge of their futures and make decisions over their own bodies is not only an essential matter of medicine, it's an essential matter of social justice. And I think in this country, it is terrible that there is still so much stigma and shame around sex. The fact that we can't talk about our elbows and knees the same way we talk about our penises and vaginas is terrible. And what does that lead to? Well, when you don't have appropriate health information, just like when you don't have enough financial information, you're going to get taken advantage of. It means you're more likely to face sexual violence. Means that you're more likely to be sexually manipulated. Sexual shame is at the core of so many mental health maladies. How many young people have we lost because they're confused or worried if they're normal or okay? You are normal. You are okay. You should have autonomy and freedom over your own body. And we have to end the shame and the stigma that is imposed upon people to disastrous effects to their health.
Thank you, Minister. Thank you, Ms. Sidhu. Suite, Monsieur Thériault, pour 6 minutes, s'il vous plaît.
Merci.
Mr. Thériault, 6 minutes. Thank you, Chair. So, Dr. Lucas, I wish you great happiness in your retirement. Minister, on the 30th of November last, the committee recommended to the House the creation of a new register for implants, dental implants. A new log or register for implants? I'm sorry, I missed that. For breast implants. Chair, perhaps you could just give me a little extra time given this confusion. I was saying breast implants, a national registry for breast implants. Will this be created or not? We will take action on this very shortly. I highly appreciate the committee's work on this topic, and we will move on it shortly. I would like to know, though, take action on it. Well, it's not sending a letter to say it's too complex. It's, taking action is setting it up. Will you set up this registry? It's a unanimous report. It is our intention to ensure we will take action on this. There is an undertaking involving all our partners in this area. But of course, it is quite certain that we will take real action on this. So will you actually do it or not? Yes. Okay. Now, in February 2021, the Scientific Advisory Committee stated that it would be smart to create a fund to ensure that women could be compensated for damages. Will you go ahead on that? Your own advisory committee. I don't have a response for you right now, but I will continue to consider it, and I appreciate your bringing it up. All right. In February 2021, the Scientific Advisory Committee recommended basic research, a funding for basic research on breast implants in order to gather more data, scientific data. So where are you on this? Have you provided funds for research to, by the way, help with the registry for breast implants, or is there any funding for this? We are in partnership with the research sector in general, and it may be Ms. McLeod who can give you more specific details and who has specifically covered our undertakings in this area. Because in November 2023, Ms. Dreesen said that there still wasn't, any funding of research on this topic. So is that happening now or yet? Thank you for the question, Chair. I will analyze our research and our programming to determine whether grants have been provided for this purpose, and I will send that information to the committee. So you don't have the answer right now. Okay. Honourable Minister, a little earlier, and perhaps I'll have a chance to get back to this, you mentioned several times, actually, a fundamental principle being the right to self-determination of persons, the free choice in matters of bodily integrity. We have had a discussion in the past when you seem to be thinking about early directives, prior directives for people with neurodegenerative illnesses. Have you thought about that any further? Have you thought about ensuring that these people have the right to make these provide early directives? Yes, on the matter of early directives or prior directives, I've had conversations with the minister in Quebec and with many others across the country. As I've explained before, this is an issue. I mean, I myself understand that your perspective differs slightly, but to my mind, this is a very complex, dynamic and issue. I do want to ensure that we continue to work closely with Quebec, collaboratively with Quebec, and with the other provincial and territorial leaders to work out a solution. A solution specifically with regard to the point you're bringing up, but also to ensure that whenever there's a situation where someone is in the types of situations we're concerned about, well, it is difficult because their opinion may differ from ours, because actually living in such a situation is different from, what we might legislate about it. I'm sorry to break you off here, but to intervene, but I'm not seeing any change. You seem to be repeating exactly what you said to me last time we talked about this. Have you or have you not read the Quebec legislation about early directives, prior directives, and what's bad about it? What's so complicated about it? I mean, it should be used as a model for the federal legislation. Yes, I certainly understand your point of view. But look, I think it's important not to work unilaterally based on a single province. We need to work together. That's not what I'm saying. No, but for me, that's the issue. Have you read the Quebec legislation? And what do you think of the Quebec legislation? Do you think it's overly complicated? Too complex? Do you think you could use it to base a federal bill on before the next election? I think that the conversation and the situation in general is a complex one. I fully appreciate Quebec's legislation, and of course I've had a chance to examine it. But for my part, I will continue my conversations with each province and each territory in order to work out a common solution. I fully understand that this is a highly delicate and emotional situation, particular for people who are living in these situations, who anticipate having a very difficult illness in the future. But at present, the conversation is ongoing. Thank you, Honourable Minister. Thank you, Mr. Thériault.
Please, for 6 minutes. You're muted, Mr. Davies. We can't hear you. If you could try unplugging and plugging in again. Otherwise, we have a request from Mr. Ellis to take over your time. We really hope it works.
Hello, can you hear me now?
Oh, we sure can, and we're very happy to. Go ahead, Mr. Davies.
We avoided a fate worse than death. Thank you, Mr. Chair, and thank you, Minister and officials, for being with us. I want to start by adding the New Democrats' appreciation to Dr. Lucas for your leadership. At a time when many people in Canada are saying everything's broken, you and your department helped build and create a solution by presiding over the biggest expansion of public health care in half a century by bringing dental care to 9 million Canadians and public drugs and devices to diabetics and people who need contraception. So I want to thank you on behalf of our party for the fine work that you and your department did on that. Minister, if I could start with you, can you confirm how many people have signed up for the Canadian Dental Care Plan to date? Approximately.
Yeah, approximately. It's a little over 1.5 million, all seniors.
Thank you. And on pharmacare, can you confirm approximately how much, say, your average person living with diabetes will save as a result of being able to access free diabetes medication and the devices that they may need?
Well, it depends a little bit upon the province or territory and what they're in and what existing coverage is. So it's a bit hard to answer, but I think it's fair to say that it's going to be very substantial. That, you know, the folks that I'm talking to, and I'm sure members of committee have had an opportunity to speak to, these costs can be extremely prohibitive and can be a major factor in them not being able to afford the essentials of life, and oftentimes are making decisions to forego medication or, as I mentioned, reusing syringes or not properly monitoring their condition, which leads to very bad health outcomes.
Thank you, Minister. Just by way of anecdote, I talked to someone recently who said that they estimated that they've spent to date over $100,000 out of pocket having to pay for syringes and needles and test strips and the medication that they need. Minister, turning to school nutrition, in the last election, both the NDP and the Liberal parties pledged $1 billion to create a national school food program. But according to recent media reports, the federal government has decided to drop its 2024 deadline to introduce this urgently needed initiative. Given that food insecurity has risen sharply across country, food bank use is at record levels, and as I'm sure you're aware, the crucial role that nutrition plays in children's health, can you confirm if your government plans to follow through on its promise to create a national school nutrition program, and if so, when?
Well, by the nature of our process, I'm as blind to what will be in the budget as anybody else. So I will have to defer to the budget document to know what's there. But I just want to validate, you know, how important school nutrition programs are. And to say that, you know, when I was at Heart and Stroke, being able to see the difference a single healthy meal a day has to children's health is incredibly powerful. It's not just powerful in that moment for that kid. It then allows them to develop a connection with healthy food, a palate for healthy food, and can be transformative for their entire life. And I think one of the things we're talking about diabetes earlier, another conversation that we really have to have as a country is nutrition and the disastrous effects of highly processed food and sugars on our health. And if we're going to really deal with health, we've got to be upstream, and certainly we have to be dealing with nutrition and the ill effects of sugar.
Absolutely. Thank you, Minister. Yeah, we heard some very profound testimony to that effect at the committee when we were studying children's health. Turning to nicotine products, experts across Canada have expressed serious concern about Zonic, that's flavored nicotine pouches from Imperial Tobacco that recently hit Canadian shelves. Disturbingly, this product was approved by Health Canada without any age barriers or restrictions on how it can be advertised or sold. We're seeing it pop up in convenience stores across the country, supported by marketing and flavors that appear to target youth. We've seen BC and Quebec take action. Minister, you've said publicly that you felt duped by the tobacco industry and you pledged a major crackdown. Can you confirm what action your government is planning to take and precisely when that may begin?
Well, thank you so much. Look, we want innovation in the space of cessation. We want innovative ideas to get people off of tobacco. It's still the number one cause of preventable death in this country. It is a horrible scourge, and tobacco companies internationally have utilized techniques that are reprehensible. So what happened here is they used that portal where we want to see innovation for cessation to pretend they were doing something about cessation. And then what you see comes out is something that doesn't match it. So I'm seeking a couple of different authorities. One is to restrict flavors to what is only necessary and logical for the purposes of cessation. In the second order, I'm seeking authority to have marketing plans shown for products that are for cessation to ensure that they comport with the approved intended use of the product before it goes out, so that we don't see the circumstances you're talking about. And in the third order, with respect to nicotine pouches, because they've already, unfortunately, in their treacherous behavior, have addicted a whole cohort of people who had no exposure to nicotine before. That they've addicted a whole cohort of young people to this product. It's my belief that it needs to be moved behind counter. That's already happened in BC. That's already happened in Quebec. But I think we have to be part of the solution to see that happen writ large across the country. So it's not just about these tobacco pouches. It's about what they did in vaping, and it's about making sure that this the legitimate space for innovation and cessation is never abused again in this kind of perverted way.
Thank you, Minister. Thank you, Mr. Davies. Next, Mr. Cooper, please, for 5 minutes.
Thank you, Mr. Chair. Minister, I presume you've read the Winnipeg Lab documents?
That's correct.
Okay. And I have as well, so perhaps you can help me with something. Can you point to exactly where in the documents it states that no sensitive information left the lab?
So I think that if you're talking about, at any time what went into or out of the Winnipeg lab, it's clear that nothing left or entered the lab.
Minister, I'm asking you to point to where it states in the documents that no sensitive information left the lab, because you stated at your February 28th press conference, immediately following the release of the documents, that you were absolutely certain, and you will see it from the documents, that no sensitive information left the lab. That is contradicted. That is at odds completely with the conclusion in the PHAC report with respect to Dr. Chu that stated, quote, sensitive information and assets were shared outside PHAC. So why did you state the opposite of what you had to have known was the truth?
Well, what I was stating, and I think it's important that we not be hyperbolic about this, and that we be rooted in truth. And the circumstance with these two Canadian citizens who, very disappointingly, in a way that one
You
couldn't
said
have
I'm
expected.
absolutely-
Mr.
I
Cooper,
don't
you
know.
took almost a minute to pose the question. You interrupted him after about 12 seconds. Finish your answer, Minister.
Thank you very much, Mr. Chair. I think in the first order, we were in a very different time at that moment in time where we were collaborating specifically on virology and thought we had a better partner and weren't aware of the extent to which the Chinese government would have been involved in trying to influence domestic affairs.
Minister, you
And
said
two
you were
Canadian citizens,
absolutely
I think I got
certain,
about
and you
12
will
seconds
see it
there.
from the documents, that no sensitive information left the lab. So where in the documents does it state that? Where? Because I just quoted from the documents, and it states the opposite of what you said.
Okay, so I guess I get about half or a quarter of the time that they get to ask the question. Well, that's your characterization. I think that look, I understand the effort.
Minister, can you also maybe help me with something else? Can you point to where in the documents it states that the scientists didn't work with the Beijing military?
I think
On
that,
what page?
Okay, so what I'm concerned about, and you've read the documents and I've read the documents, and there were concerning things that happened there. There's no question that are unacceptable. These eminent scientists who were Canadian citizens lied to us about their engagements. That's deeply disturbing.
Minister,
but
you
I think
said
in a hyperbolic
that you made
way,
that
well,
statement
Mr. Chair, okay, I don't-
unequivocally in your press conference. And again, if you've read the documents, which you claim you have, it states very clearly that the scientists collaborated with the Beijing military, including the highest medical research institution in the People's Liberation Army, and that Dr. Chu collaborated with Beijing's chief biological weapons defense expert in areas of biodefense and bioterrorism. And yet you said that they didn't collaborate with the Beijing military. How is it possible that you could have said that when you had to have known that the opposite was true? Why were you spreading disinformation?
I don't know. Maybe I'll get 5 seconds so we'll see how much I'm allowed to say before I'm given the opportunity. First of all, I think that it is incredibly dangerous to play games with national security and to mischaracterize what were very unfortunate events. I don't believe your characterization is at all accurate or representative of what's in the documents. I believe it's hyperbolic. I believe its intention is partisan.
Minister, I quoted you,
Sorry,
and
Mr.
I quoted
Cooper.
the documents.
No, Mr. Cooper, he's about halfway through. Go ahead.
I believe your characterization is hyperbolic, not representative of facts. I think you are seeking to extract partisan advantage from a matter of national security. These were Canadian citizens who were eminent scientists who lied to PHAC and who worked in the area of virology. Now, you would know as well as I know that in China, every aspect.
Thank you, Minister. This is your last question, Mr. Cooper.
Think you were going to get away with spreading disinformation. Either you didn't read the documents and you're not on top of your brief, or you were spreading disinformation in a pathetic attempt to further the cover-up of this massive national security breach that happened under your government's watch. Which is it?
Minister, you have 30 seconds and you won't be interrupted. We're past time. Go ahead.
Well, and I think the truth is, and frankly, it's evident in the way that you posed your question, that your interest is a partisan interest. Your interest is to play games with matter of national security and not give me the opportunity to contextualize the circumstance. And I think that's unfortunate. And I think that it's unfortunate that we've moved to a place where matters of national security are used as partisan footballs. I think that, yes, it is deeply disturbing that these Canadian citizens who were eminent scientists behaved the way that they did. DHAC acted appropriately. They were fired. There's an investigation that's ongoing. And an attempt to characterize it as some grand conspiracy is inappropriate.
Thank you, Minister. Thank you. Thank you. Mr. Johari, please, for 5 minutes.
Thank you, Mr. Chair. And let me start by thanking Mr. Lucas for the great work that you've done. Often as politicians, we roll out policies and we stand in front of cameras and microphones and blow our horn, but it's really amazing individuals like you and your team who make sure that these policies are actually translated into benefits for Canadian. And we thank you. Whoever happens to be filling out the shoes that you believing has a great infrastructure under him, but also big shoes to fill. Thank you. Mr. Holland, since you didn't get a chance to really respond, I'll give you as much as time that I have to be able to really respond to the amount of, I believe, misinformation and the narrative that's being built here. And I think you deserve to have the time to be able to set the record clear. Sir, you have as much time that I'm allowed to have. Time is yours, sir.
Thank you so much. So first of all, I think it's important to see how unfortunate the way that this is being played with is, to go back in time. When I was in the Public Safety Committee, we received the reports from Justice O'Connor and Justice Iacobucci, who said that parliamentary oversight of our national security apparatus in all matters of national security was essential. We begged the government of the day to act, to create parliamentary oversight, and to create civilian oversight of the security and intelligence apparatus. The Conservative government of the day refused. And so there's some great irony in the fact that I'm being attacked when the documents that they're talking about would have never come to light. We would have never seen the documents, and nor would we be having the debate if a Conservative government got to continue, because they completely ignored creating those oversight mechanisms. It was when I was House Leader, and at the time members of Parliament said that they wanted to see, and you remember there was ridiculous conspiracies being spun about what was in those redacted documents. And at the time, I said that all parliamentarians, we should have an opportunity to see into it. And somebody made the comment, I can't remember which of the opposition party House leaders it was, that NSI COP wasn't enough because they wouldn't have the ability to challenge the redactions. So it was this government, and I was House Leader at the time, and said that's fair. So let's create a process where those redactions can be challenged by an independent arbiter. And so we had a committee of parliamentarians. We're looking at all of the documents, and the arbiters made a decision to waive the normal considerations of privacy that involve employee data so that we could have that information. And I think that's entirely appropriate. So everything that's being discussed, the entire report, and this is what's, I think, positive and unfortunate for the Conservatives. They can now try to spin conspiracies, but there's no more shadows for them to hide in or pretend things that are there. Now you can read the document yourself. And what you will see in those documents is two eminent scientists who are Canadian citizens who lied to the Public Health Agency about interactions that they had, and that those interactions were in the area of virology, and that the attempts to characterize it in some darker or more sinister way, that somehow the government was trying to hide it, when it is in fact the government that is the reason they have the documents, and it was their government that would have shut the door from those documents ever been seen. So it is the height of hypocrisy, because you know what would have happened? The same events would have occurred if you had a liberal or a conservative government. These are happening inside of our public health agency. If you believe differently, then you would be believing that the conservatives in government would reach their hands into the public health agency and decide whether or not they would hire a Canadian citizen who's an eminent scientist and override public health officials who's there. And of course, that's ridiculous. It wouldn't happen. So the same events would have occurred. The only difference is if a conservative government was present, these documents would have never come to light. Canadians would have never seen the information, and certainly parliamentarians wouldn't, because at every step of the way, they blocked efforts to have the process that's here today. So in its full light and character, it is absurd.
Thank you. That gives me 15 seconds, which I yield back to the chair.
Thank you very much. I appreciate
Thank you.
the opportunity to say that.
Thank you, Mr. Johari. Mr. Thériault, 2 minutes et demi.
Mr. Thériault, 2.5 minutes. Thank you, Chair. Honourable Minister, freedom of choice, self-determination, these are not abstract concepts. These are realities, and the realities of people who suffer. What do you have to say to Sandra de Montigny, who has early dementia, beginning of her 40s, who came to tell us that she wants to shorten her life, and she won't be able to unless the feds work on this and go ahead. And you're telling us that you're thinking about this? So tell us why she can't shorten her life. So be courageous. Tell us why you're still not bringing forward a bill to this effect. Talk to her directly.
Just in English in a second, for the sake of clarity, and because I want to express the appropriate compassion for the person in that circumstance. I can't imagine it. My grandmother was lost to Alzheimer's, and I had to go visit her in a long-term care facility for 15 years as she suffered, and it was horrible. And I can't imagine that circumstance. And what I would say to her is that we have to work through these issues very carefully. I'm so sorry for her suffering. And that the ability for people, as you say, to have determination over their own fates is essential. But one of the challenges with advance requests is that you're talking about a future date in which you are not living. I can tell you that I had no idea, what it would like to be 50 years old. When I was a kid, I had many ideas of what it would be like. But when you live an experience, it's totally different. So when you make a decision for a future self that you do not know, in circumstances you do not understand, there is a complexity to that. And that's what I'm trying to convey, is that for anybody to imagine the situation that they would be in the future, to consign themselves to a fate of death when they don't know what they will be feeling and thinking in that moment is complex, and that we need to work through it carefully. And that when you get into families and how families will feel about those things.
M'excuse, Monsieur le Ministre.
I'm sorry, Minister. This woman has early dementia. She has no other choice but to end her life early, which, of course, is related to the Baudouin decision, as you're aware. And even though you're aware of this, you're doing nothing, specifically doing nothing, to help her manage her anxiety and her suffering. You've done nothing since our earlier conversation. How can you set aside the Carter decision, the Baudouin decision, and avoid responding directly to this level of suffering? Short answer, please.
Chair, I of course have the same compassion that you have. I watched my grandmother in that exact state as her grandchild, watching her slip into dementia as that disease took her. I couldn't have more compassion for her, because I understand all too intimately, as too many Canadians do, what that circumstance is. But when we make a decision, it isn't for just now, it's forever. It's not for one person. It's for millions, if not tens of millions of people in the totality of history. So in any circumstance, one of the hardest things, frankly, as health minister,
Le Québec a pris la décision, Monsieur le Ministre.
Merci,
Inspirez-vous.
Quebec made a decision, so just to take the Quebec example, just read the Quebec approach.
Mr. Davies, please, for 2.5 minutes.
Thank you, Mr. Chair. Minister, to pick up where we left off, has any vaping product or nicotine pouch received any approval by Health Canada as a smoking cessation device?
Yeah, for sure. Vaping, look, there are applications for vaping.
Now, has any been approved, Minister? Because it's my understanding that no vaping device has been approved by Health Canada as a smoking cessation device. It's often marketed as such. But my question is, has there been official approval by Health Canada as a result of an application made that establishes these products as effective smoking cessation devices?
There's been. You're correct in the instance of vaping that there has been no product approved for the purpose of cessation. But you're right; it has been marketed and held out as a cessation tool. And of course, deeply concerned, and we expressed this when I was at Heart and Stroke, that as I was watching the beginning of it, talking about how disastrous the potential health impacts of it were, it was a mismanaged situation. I think there was hope that it was going to be a cessation tool, that it was going to be used for the purposes of cessation, and that at that time I worried very publicly about the future that we're now in. That it ended up becoming something that was a new delivery mechanism for people who weren't otherwise
exactly,
addicted.
Minister. So, I mean, as health minister, I mean, that's the issue is big tobacco. Many think that big tobacco are using devices under the guise of marketing them as smoking cessation devices, but they're frankly just another vehicle to hook a new generation of Canadians on nicotine. And anyway, I'll move on to a different subject if I can. Minister, many health practitioners, small business owners, and consumers across Canada have expressed serious concerns to this committee and others that the government's proposed regulations, including labeling requirements and new fees for natural health products, will result in increased costs and reduced choice for Canadians. Minister, would you be willing to pause those regulatory measures to ensure adequate consultation with those groups and others on the potential impact on Canadians?
Well, we have been having excellent consultations, and in those consultations have resulted in us making sure that we're adapting the information that we're hearing from industry and from users of natural health products. I mean, I think it's important to note that it is an exploding industry and that it has a great utility, but that the making sure that folks are getting what they actually are buying, making sure that there's appropriate quality control, making sure that there's on-site inspections, that folks are aware of adverse impacts if they use the product, if they're using on another drug, or they have susceptibility of winding up in a circumstance where they would have an adverse reaction to using it. Like, that's really essential information. That's saving lives kind of information. So we can't set that aside. We need to continue to work on that while we work through the concerns of industry, and that's precisely what we've been doing.
Thank you, Minister. Dr. Ellis, please, for 5 minutes.
Well, thank you very much, Chair. Minister, you've been very careless with your use of the truth here today, and that's very sad on behalf of Canadians. When we know very clearly that the president of PHAC was called to the bar of the House of Commons, we know that your government, your Liberal government, took the Speaker to court to prevent these documents from coming to light, and we also know that your government called a COVID election to prevent these documents from coming to light. So your application is reckless, it's careless on behalf of Canadians, which is what sadly we've come to expect from you, not to mention you've been exceedingly careless with the truths that you have expounded on a multitude of other topics today. So that being said, who is accountable for this egregious breach of security? Who is it?
Well, in the first order, I will completely reject and disagree with what you said at the beginning. The dispute that occurred within the House of Commons was that the government at the day, which was our government, said that this matter could be, all the documents could be seen at NSICOP. And the position of Parliament was they wanted to table drop national security documents. So we can't let that happen. Carelessly treating national security documents would have profound implications for our Five Eyes partners. Now, we de-escalated that, as you will recall, by me suggesting that we have an ad hoc process with a group of panels and arbiters that could independently review those documents and make them available. Everything that I said to the letter is true. You saying something isn't true, well, an interesting, rhetorical device doesn't make it true.
Well, thank you very much, Minister, and obviously the same is true for you. The facts speak for themselves, considering the fact that you don't even know what's in the documents. So who is accountable? Who is it for this mess?
Who's accountable? I'm accountable.
You are. Excellent. Who will you hold to account at PHAC?
I believe PHAC acted in a way always in the highest order.
Who will you hold to account?
I have looked at the situation,
I didn't
and I
ask you
believe
that. I asked
PHAC
you who
handled
you
the
will hold to
situation.
account. Who is it?
Me,
Who at PHAC? Who's going to lose their job over this?
nobody.
Nobody. So there is an act of treason, and of course, treason is defined in the Criminal Code of Canada as the sharing of military
you
or
accusing of
scientific
treason?
information
Who are you
with
accusing
an
of
agent
treason?
of a foreign state.
Who are you accusing of
listen,
treason?
I'm not here for you to ask
If you're
me
going to
questions.
accuse somebody of
You are
treason,
here
you're
to
absolutely
my
going to answer
questions,
for it.
mister,
Who are you
and
accusing
your
of
crazy
treason, sir?
bombast and
Who
your
are you
foolish,
accusing?
petulant
Who
behavior
are you
is
accusing of
not going
treason?
to make this committee bow
Minister,
down
You
to
can't
your
accuse somebody of treason and not
ridiculousness.
name them.
So
That's
I think
totally
that
irresponsible.
I'm here to ask the questions,
Minister?
and you're here to answer them, which you continue to refuse to do. So this is actually a point of privilege if you don't want to answer the questions. Is that how you want to do this?
What I want to be able to do is understand who you just accused of treason, sir. That's an incredibly awful accusation.
Do you know what the definition of treason is?
Who are you accusing
I
of
didn't-
treason?
No, I'm asking questions. Do you know what the definition
I get to
of
ask
treason
questions.
is?
You don't get to dictate that.
Do you know
Who are
what
you
the- do you
accusing
know
of
what the
treason, sir?
definition of treason
Who
is?
are
Yes
you
or
accusing
no?
of treason?
Oh, you really have no idea.
Who are you
That's
accusing of
exactly
treason?
what Canadians want to hear.
Who are you accusing
What's
of
the
treason?
definition of treason,
If you
Minister?
are going to accuse somebody of treason in this country, that is a reprehensible
You
thing
know
to
what?
do, and
do
I
not-
would ask
I
that
do-
you
I
name
do
who
not
you were
need to
accusing of
answer your
treason.
questions, but you need to answer mine. What is the definition of treason? Do you have any idea?
Well, I'd be curious. You named somebody as being treasonous, so who are they, and what's
I
your
asked you what the
definition?
definition of treason is. Do you know what it is?
Betraying your country.
No, that's not it. It is actually, very simply, knowingly communicating military or scientific information or documents to an agent of a state other than Canada with the intention of jeopardizing the safety or defense of Canada.
So
Did that happen at this lab?
in neither you nor I are a lawyer, but you and I would both know that calling somebody something like a
You know what, Minister? You're not a doctor, but
Committing
you
to-
made a whole bunch of claims today that are non-scientific
but naming
as
somebody,
well.
saying that somebody is a traitor, okay,
I'm simply asking you the
is
question.
a very serious accusation, and I would say that it's normally a matter that would be determined by courts.
Yeah.
And
But
so
you
I'm
don't
asking,
even-
I had
don't
asked
even
you
know what
who
the
you would.
definition is, Minister. You have no idea. You're clueless.
Well,
You
that's
have
your
no idea what the
characterization, and I
answer is.
don't know that. I
You're
think you felt
reckless,
that.
you're permissive,
But sir, you felt that
you
way
are loose
before
with
you
the
met me.
facts.
You're so blinded by your partisanship, you would have thought that about me before you even spoke to me.
No, you've actually
you-
proven it today that you don't
Chair,
know
point
the
of
facts
order,
of your
Chair.
file. That's the worst
Point
part.
of
Well, I
order,
don't know what the
Mr.
purpose
Naqvi.
is. You have no idea.
Excuse me. Retreat to your corners for a second. Go ahead, Mr. Naqvi.
I just really fail to see the line of questioning from the member opposite. What I find it even more disappointing is the constant name calling that he has taken, and I've let it go for a few times, but that does not advance a thoughtful, rational questioning. He's got legitimate questions that he wants to ask, but he can ask them in a manner that are to the point and factual beside calling names.
Yeah.
Thank you.
Thank you, Mr. Naqvi. I'm inclined to agree, Dr. Ellis. You're absolutely entitled to ask aggressive questions, but there's no place for insults. Please go ahead.
Thank you, Chair. I would say I have about 30 seconds left. I think pointing out to Canadians that this minister doesn't know his file, that he's reckless and permissive and lax with security, I think that that's absolutely accurate and adequate. Absolutely. So the question here is then, what you're telling Canadians is that no one will be held accountable for an egregious breach of security, sending talent and information and abilities to a foreign hostile power. Is that true, sir?
Canadian citizens in question were fired. The Canadian citizens in question are under investigation, as is appropriate. They are eminent scientists who lied to PHAC and misrepresented their actions.
These are eminent
and there were
scientists.
consequences. These individuals were fired and under investigation.
If I might
The fact that
Mr.
you are
Chair, I
not
would
achieving
suggest
your
that the
partisan
minister
ends
needs
is
to hold
not
his
my
questions
concern.
as well, Chair.
Thank you, Minister. Thank you, Dr. Ellis. The final round of questions will come from Ms. Briere for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister, and all the officials for being with us today. Dr. Lucas, thank you for your service, leadership, and vision. Minister, we know our response to mental health is stronger when provided as part of integrated care. Can you expand upon how we are integrating mental health care as part of the greater healthcare system?
Well, thank you so much, and thank you for your work, Madam Briere, in this area. You've been such a leader in the space of mental health, and working towards that very outcome. In the first instance, it is the working together agreements, which have at their core an integration of action on mental health and better integration into the overall health system. Making sure that that folks get the help and support that they need. And so that means making sure that it's culturally appropriate, that we're attacking systemic racism, that people are entering environments that are sensitive to who they are and have them be comfortable and safe in navigating the incredible challenges that are faced with mental health issues. Many of these are very intransigent, and of course they have at their core trauma. There's a direct proportionality towards people who've experienced trauma and incredible pain and the outcome to poor mental health. So it is not surprising then that our most vulnerable and marginalized people who've been subject to racism and the effects of colonialism are the ones who disproportionately suffer. And so we have to take a whole of government approach, and it's not just inside of our health system, as I know you advocate for. It's about making sure that we have housing. It's about making sure that we have food security for folks and that people have access to the full range of 360 supports that you need when you're in that kind of state. And the thing I would say about why it's so important to do that is that when you don't appropriately deal with somebody who's in a state of mental health crisis, that situation will deteriorate and manifest itself in all kinds of other terrible health outcomes. And of course, a person can't be productive if they don't have strong mental health.
Thank you so much. I will switch in French. One of the factors affecting mental health is environment. This week, we saw a report come out to the effect that the air in Canada has been affected by last summer's forest fires. So what are we doing at that level when it comes to health and the environment? There is no more important an issue than this. Our environment. It's our environment, and that's our future. It's essential to our future. It's also essential that we come up and respect an action plan to fight climate change. Taking action in the current context as well is important. When there's an environmental crisis, we must be there to work on the situation, to improve situation, to ensure that people receive the services they need in such situations. And that's why our agencies are there when there are environmental disasters such as the forest fires, and this will remain the case in the future. This is also why it's of the highest importance to continue our action for clean air by respecting the pricing for pollution precepts and many other actions for the environment. It's linked to our health. Our health is linked to our environment. It's so important to attend to this. And the cost of forgetting this, of not dealing with this, would be extraordinary and totally unacceptable to Canadians.
Thank you, Madame Briere. And thank you very much, Minister. Dr. Lucas, all kinds of tributes to you today. Let me simply wish you a long, happy, and healthy retirement. Thank you again for your service to the country, but also for the numerous times that you've come before this committee and been extremely patient and professional with us. It is always appreciated. That concludes the first panel. We're going to suspend now to allow for our next panel of witnesses. Thanks again. Thank you, Minister. We're suspended. Order, and I'd like to welcome our second panel of witnesses, the Honorable Yara Sachs, Minister of Mental Health and Addictions, and welcome to the officials joining us for the second hour of this meeting. From the Canadian Institutes of Health Research, Samuel Weiss, Scientific Director, Institute of Neurosciences, Mental Health and Addiction. From the Department of Health, Jennifer Sachs, Associate Assistant Deputy Minister, Controlled Substances and Cannabis Branch. And from the Public Health Agency of Canada, Nancy Hamzaoui, Executive Vice President, and Michael Collins, Vice President, Health Promotion and Chronic Disease Prevention Branch. Welcome back to the committee, Minister. You have 5 minutes for your opening statement. Please go ahead.
Thank you, Mr. Chair, and to honorable members. It's a pleasure to be joining you here today, and thank you for the invitation. I'm looking forward to having meaningful and important conversations that I know matter to Canadians. I'm pleased to provide you with updates on some of the work we are doing to address the issues of mental health and substance use. But before I begin, to add to the many tributes to Dr. Stephen Lucas that are well-deserved, since coming into this position, Dr. Lucas and his team have really guided myself and Minister Holland with such a steady hand and a calm vision of what is important in the health of Canadians. Dr. Lucas, you leave a legacy that is impressive by all standards and accounts, and you have served Canadians so well, and for that we are truly grateful. Colleagues, this past fall, our team and myself launched the 988 Suicide Crisis Helpline, providing access to bilingual, trauma-informed, and culturally appropriate suicide support to all Canadians. It is available 24 hours a day, 7 days a week, and I know we've worked across party lines on this initiative because helping Canadians should never be a partisan issue. In its first 2 months of service, 988 responded to over 72,000 calls and texts from across Canada. This helpline represents an important step forward in providing timely and accessible access to crisis mental health supports. We continue to work to build the overall capacity of the healthcare system through our historic investments of $200 billion over 10 years. This includes $25 billion in bilateral agreements that outline specific actions, including those to improve access to mental health and substance use services. Through these agreements, some of the actions supported by federal funding include supporting more integrated youth service hubs, reducing wait times for community mental health and substance use services, expanding access to provincial programs that provide counseling and support, and prioritizing culturally appropriate services where needed. On top of these specific actions, mental health and substance use care is being integrated throughout the whole healthcare system, from family health services to the health workforce to data and digital tools. This will improve the system's capacity to respond to patients' needs for mental health and substance use support, because as we know and we say often in this place, mental health is health. Tragically, the toxic drug supply and overdose crisis continues to cause immeasurable pain, suffering, and heartbreak across our country. I want to acknowledge the important work this committee has been doing to study this critical issue. I know that we all share the same determination to end the overdose crisis and to save lives. This echoes what I'm hearing from my counterparts across the country, that we have the same objective, helping Canadians. To do that, we need to learn from experts, in particular those working on the front lines of this crisis. They are truly the heroes of the healthcare system. We need to listen to those with lived and living experience, including family members. And as leaders, we need to work cooperatively to ensure a comprehensive and compassionate approach that is patient-centered. Our government's actions are guided by Canada's model, our goal to ensure that all Canadians have access to services and supports across the spectrum of prevention, harm reduction, treatment, and recovery, while also leveraging enforcement tools to keep our communities safe. As part of our approach, we are investing in programs like the Substance Use and Addictions Program, which allows us to support community organizations who are working directly to reduce harms and support people in need. As you've heard or may know, the illegal drug supply is deadlier than ever before, with potent substances like xylazine and nitazines entering the already lethal illegal drug supply. This reality puts all those who consume substances at high risk. It also compels us to act to ensure that life-saving interventions are widely as available as possible, including in rural and remote areas of the country. Colleagues, we have much more work to do in this space. However, I look forward to having meaningful discussions today on the work that is already in play and how we can better serve Canadians. I look forward to your questions.
Thank you, Minister. We will begin with rounds of questions, starting with Mr. Doherty, please, for 6 minutes.
Minister, thanks for being here today. I have a lot of questions, but first, I know you probably saw Minister Duclos and Minister Anand's press conference on fraud yesterday. Has Mark talked to you about fraud at Health Canada?
I am aware that they are looking into those allegations.
So you're aware of some investigations mentioned yesterday pertain to Health Canada?
I know that there are investigations that are ongoing.
Okay. So are any of the new 5 to 10 cases being examined from your department?
At this point in time, I am not aware that they are.
Okay. So, okay. Thank you. There are investigations underway that involve PHAC.
PHAC also crosses not just my department, but Minister Holland's.
Okay. Thank you.
You're welcome.
Okay. Thank you. Minister, is diversion illegal?
Yes, it is.
Okay, thank you. Minister, is London Intercommunity Health Centre receiving funding through SUAP this fiscal year?
Yes, it is.
Okay, thank you. Minister, have you read the new letter from 72 BC-based addictions doctors blasting so-called safe supply?
I have read the letter, and I have met with many of the experts
Okay.
and physicians with regards to safe supply.
Thank you. Mr. When Dr. Sarita was here the last time, she mentioned that she admitted knowing that some of her prescriptions get diverted. Question, why is her clinic still receiving funds, taxpayer funds?
Thank you for the question, and as I've said in this committee before, I take diversion very seriously, as do all of our department, and at that time, we asked officials to thoroughly review the protocols of all of our 21
Okay,
safe
so has
supply
the funding
projects.
been cut off? Your testimony just prior to that was that she is still receiving funds. Her clinic is still receiving funds. Taxpayer funds that are going to, what you said, to a clinic that is prescribing safe supply, that they know, the prescribers know, some of it is being diverted.
So overall, across Canada, diversion is not something new. We know that there are low
Okay.
levels of diversion.
Do you
that
have the
do happen.
evidence?
The
Do you have evidence
RCMP has
regarding-
provided thorough information on their position on diversion. Are you referring specifically to a nationwide lens or specifically to
Is
that
there a
one project?
nationwide lens? Like, is there evidence nationwide with respect to safe supply
The
and
RCMP
diversion?
has said that there is no evidence of widespread diversion of drugs from prescribed
Oh,
alternatives.
that's interesting. That's interesting because just last week, you're probably aware of it as well, too. There was a large bust in my home community of Prince George where the local officers and local leaders, RCMP leaders on the ground there that said there is widespread evidence and that it is taking place in our small rural communities. Are you aware of that?
I'm aware of that, and I'm also aware that Assistant Commissioner John Brewer at the top Mountie in BC said that notable quantities of prescription drugs were seized, but there's currently no evidence to support widespread diversion of safe supply drugs in the
So-
illicit market in BC or in Canada.
So are the frontline officers that are actually on the ground making these arrests, are you saying that they're lying?
I'm saying that the data is showing us from drug analysis seizures over the past 10 years, including when the Conservative government was in power, that there's been no increase in diversion of hydromorphone over the last 10 years based on the samples.
So there was no.
So from your
how-
previous government's
So how long has the
administration until
SUAP
now,
program
there's been
been in
no
place?
change.
How long has the SUAP program been in place?
Pardon me?
How long
The
is
SUAP
this?
program is ongoing, and the next round of funding will be for the next 2 years.
Okay. Minister, how much, so prescribed safe supply has been, your government launched a program, spent about $700 million on that, almost $1 billion. What work did PHAC do prior to, or your department do prior to launching that to study the evidence that Safe Supply was indeed safe?
So I've just returned from Vienna, where I was at the UN Drug Commission meeting with counterparts such as Switzerland, Portugal, and many other countries who have long-standing evidence of the importance and value of
But I didn't ask that.
alternatives.
I asked what work
So
was
there's
done
ample
prior to.
I'm answering your question. You've
But
asked
no,
what
you're saying that
evidence-
you attended. What work was done prior to, by your department, prior to launching that? That was my question.
We are relying on evidence of other jurisdictions to begin our evaluation
Is it,
of what would work
is it
here.
scientific evidence or is it
Absolutely.
anecdotal evidence?
No, it is not anecdotal evidence. Switzerland has a long-standing prescriber.
Because it's
prescriber
interesting. So
model.
are the 72 doctors and indeed the other 42 leading addictions specialists, are they lying when they say there's no scientific data beyond 7 weeks at the 1 week mortality rate with Safe Supply?
I reject the premise that anyone is lying. As I said in my opening remarks, we value the opinions of experts, those with living experience, and clinicians, and we include all of them in our contemplations and deliberations.
One question, Minister. Can you table with this committee the work that was done prior to the evaluation, the long-term evaluation that the department did prior to launching the prescribed Safe Supply, taxpayer-funded Safe Supply?
I'll pass it to ADM Costins, who was a key policy participant in the program.
Thanks for the question, Mr. Chair. There was an expert advisory group that tabled a report prior to launching the projects. Happy to provide that to the committee.
That would be great. Thank you.
Thank you, Mr. Doherty. Next, Mr. Nakvi, please, for 6 minutes.
Thank you very much, Chair. Welcome, Minister. Thank you for your presentation. You spoke in your presentation about that Canada is going through an opioid crisis. It's taking countless lives, and you see your job, your mission to save lives and help Canadians. And I think every one of us and every Canadian will agree with you that that's precisely what we need to do. My question to you is, what steps do we need to do to prevent these deaths? That's, in your view, the experts you've met, both nationally and internationally, in dealing with the crisis, what are the steps necessary so that we can save the lives of Canadians?
I thank you for the question, and it's what I refer to as the Canada model, which are rooted in 4 key principles that provide a full continuum of care for those who use substances and need supports through our health system. I would say first and foremost, we have to understand that this is a health crisis. It must have a patient-centered lens and also a human rights lens. And when we take that as our starting point in saving lives, we need to understand that the upstream actions that we take are prevention. For those who use substances, we want to create forums for harm reduction, whether it is safe consumption sites, offering outreach centers, and so on and so forth, so that we bring those who use substances into a place of safety and also to be able to open the door towards the healthcare system for them. From there, that we can contemplate treatment. Those who come through our harm reduction services that are provided by provincial jurisdictions are then able to have access to treatment options that are available to them. But all of this works under the understanding that both community safety and community engagement is also important, which is where law enforcement plays an important role in ensuring that drug traffickers, organized crime, money laundering, and those who are manufacturing the deadly illegal toxic supply that we are seeing on our streets is tackled firsthand by frontline enforcement.
Thank you. You mentioned in your answer the importance of safe consumption sites. There's a lot of misinformation about safe consumption sites. There's one in my community here in Ottawa Centre, and I've seen firsthand the manner in which it saves lives and saving lives. They get SWAP funding, and I'm appreciative of that. Can you explain why these interventions provide critical supports to people who use drugs? Give Canadians a bit of a glimpse in a safe consumption site, and what would they see? You and I have visited one in our respective communities. Many Canadians have not.
Thank you for the question. I'll start by saying that harm reduction is healthcare. It is a healthcare service, and that we know that supervised consumption sites play a key role in that. and we have the data to back it up. Since 2017, safe consumption sites in Canada have seen over 4.4 million visits. They've reversed 52,000 overdoses, and close to 400,000 have been referred to treatment through those processes. So we know that when safe consumption sites are available, that we are reducing the risk of death, disease, and infections by those who use drugs, and ensuring that they have access to a wide range of health and social services to help them on the pathway of treatment and recovery. Closed supervised consumption sites in areas, jurisdictions that do shut them down, we have seen an increase in overdose deaths, but that is also attributed to the very toxic, poisoned street supply. But that means that safe consumption sites also need to be well-resourced, well-staffed, and well-engaged with local communities. When we look at programs such as in Switzerland, Portugal, and other jurisdictions, good resources and well-staffed harm reduction initiatives do yield good results and save lives.
Thank you. 2 minutes. Great. Thank you. You spoke about what we refer to as wraparound services that these safe consumption sites provide. The one in my community in Ottawa Centre at Somerset West Community Health Centre is located as part of a community health center, so they have that capacity. And every time I've had conversations with them, they talk about social detriments to health. They talk about adverse childhood experiences, trauma, poverty, mental illness, and chronic pains, all factors that kind of led to an individual taking these substances and all the effects that goes with it. So can you talk about that type of a patient and the kind of comprehensive approach required to give them healthcare services that is fulsome, dealing with all those challenges that they may be facing?
Thank you for the question. And I think it's important for us to look at the Canada Drug Substance Strategy as an integrated approach. With the renewal of the strategy, which we call the Canada model, we are working across departments now, so addressing poverty, housing, and other social determinants of health. But what we do know is that when someone uses substances, it's a result of what's, we say from the trauma-informed lens, not what's wrong with you, but what happened to you. And that really is a key component of providing the services that an individual needs. We know that in Indigenous communities there is intergenerational trauma, and we see that reflected in the high proportion of substance users who are from Indigenous communities. We also know that there are a myriad of factors that can result in someone using substances, whether it's through prescription opioids from pain management or other factors. And our job, once they come to us for help or to their local healthcare provider, that we can't just look at it in a singular lens.
Thank you, Minister. Suite Mr. Thériault pour 6 minutes, s'il vous plaît.
And now to Mr. Thériault, 6 minutes. Thank you, Chair. And welcome, Honourable Minister. I will begin with a question that's slightly technical, and then I'll pick up on the drug bust carried out by the RCMP to learn a bit more about it. Now, the aim of 2023 was $144 million for the PODS program, the addiction treatment approach. This was to allow for public support and street workers and so on based on actual scientific data. And on the 1st of February, you stated that the new series of funding proposals had been accepted and were being reviewed and would shortly be announced and put into effect. First question. Have you reached the candidates for funding? Is this already underway, but the results not yet announced? Second question. You also said when you were asked about the funding of the safe supply funding projects, you said you got in touch with those in charge and all the programs now underway that are coming to an end will be refunded, but those that have appropriate mitigation measures. So what is that, the sort of appropriate mitigation measures, those who are being funded, do they know they're getting new funding? And what sort of requirements are we referring to here?
Yes.
Je dois avoir les gens qui vous accompagnent faire les recherches. Que ma question est.
And I see the people with you are looking things up. It was slightly technical as a question. I'm sorry. We could also move on to another question if we need to wait for your officials to look up the material.
They're pulling some of the more technical details with pleasure. As many programs across the federal government, the SUOP program was very highly oversubscribed, showing that there is a high demand and need for services through SUOP in local communities. That being said, applicants have not yet been contacted in terms of who will be receiving funding. That will be forthcoming in the coming months. With regards to yeah,
and the mitigation issue.
The mitigation issues. So, as I mentioned in my previous visit here, there are, and I will correct what I said previously about 21, there are 25 programs in the prescribed alternative stream that are funded by the federal government. A deep dive was done by officials, and Jen Sachs can go into further detail, but I can tell you it was a deep dive to ensure that there are mitigation protocols in place to prevent diversion. These include things like patient review of eligibility for prescribed alternatives, ensuring that they are on a regularized schedule, ensuring that there is ongoing contact and relations with those who are in the program. I'd also like to clarify prescriber alternative interventions are meant for those who have deep addictions to substance use, that without this entry point of assistance, they would turn to the illegal toxic drug supply and be at high risk for overdose death. But to speak more about the deeper dive details of what protocols were put in place, I'll ask Jen Sachs to answer, if you don't mind.
Sure, happy to. Thanks. So we did take a number. On a pris plusieurs étapes pour.
So we went through several stages. We contacted all the projects that had applied, and with all of them, we asked for further information about their entire protocols regarding safety, safe supply, and risk reduction. Then we worked up all the measures that should be taken, and these will include, and I'll run them off in English because that'll be more efficient for me.
Patient risk or patient screening, efforts to better match drugs to the patient tolerance. So we've heard to make sure that it meets their needs in the increasing toxic drug supply. Risk-based protocols for assessing patient eligibility for take-home dosing, patient monitoring, actions to address instances of diversion, which could include switching to observed dosing, transfer into different support services, and removal from program. There's more details behind each of those, but we pull together all of those lists. We are working with them to ensure they have the capacity to address those, and they need to be able to put those measures in place so that we can absolutely reduce those risks.
Among the measures to avoid diversion, could you name a few of them? Of course. And this is indeed to reduce diversion risk. We need to ensure that there's a screening of the patients, for example, that there are agreements with the doctor, the medical practitioner, and the client, linking the two with an agreement, and that
basis for those take-home doses. We want to make sure that they have sufficient capacity for witness dosing where that is needed for that individual client, that there's regular urine and random urine drug screening test.
Okay. Thank you, Mr. Thériault. This brings your time to an end.
Please, for 6 minutes.
Yeah, well, thank you, Mr. Chair, and thank you, Minister, for being here. I'm going to get right to questions quickly here. Minister, you talked about the importance of supervised consumption sites. My first question, will Health Canada step in to fill funding gaps for supervised consumption services, given the closure and threats of closure in Ontario and Alberta?
I want to thank the member for his question and also for his deep and strong advocacy in working in this space. We know how important it is to him. As the member knows, the federal government approves safe consumption sites to be open. We do not support their overall operating funds. We can support programs through SUOP within their facilities. But I need to be clear about this, that we take the lens that this is an interjurisdictional effort. That means that provinces need to be on board. They have signed bilateral agreements for mental health and substance use supports as a key principle. We've seen 37% of the funds allocated overall in bilateral agreements, which is more than a third of their own agreements towards mental health and substance use. But it is a healthcare service that we continue to push local jurisdictions to support.
Minister, I'll just add, we have seen deaths skyrocketing in Alberta and in Saskatchewan as well, where they're fighting safe consumption sites. That's not good enough. And I'll get to my next question. Minister, if the government believes substance use is truly a health issue, then why is the majority of funding for the Canadian Drugs and Substance Use Strategy going to law enforcement?
I'll thank the member for the question, and I'll say this, that when it comes to how we are tackling the opioid crisis, as I said in my earlier remarks, we're looking at a full continuum of supports that include enforcement. When we look at the breakdown of what we are doing, it's not an either or. Also, the enforcement funding that you are referencing is across departments, so it's not only from Health Canada that's contributing to those amounts. In terms of enforcement, it is also public safety and local jurisdictions. In terms of prevention and harm reduction, 61 million it was allocated to harm reduction between 2017 to 2022, and also 134 million to prevention. And in addition to that, 93 million to treatment. But again, this is a shared responsibility, respectfully, and
Minister?
in administering healthcare.
Go ahead, Mr. Johns.
Yeah, thanks. This gets right to the question that I want to ask, Minister. And you've heard me say this before, that, disinformation in a health crisis costs lives. Incrementalism in a health crisis costs lives. So, Minister, do you actually believe the funding allotted to address the substance use toxic drug crisis at the federal level is commensurate with the scale and scope of the toxic drug crisis taking place right now in this country?
I would say that since 2016, this government has ensured that over $1 billion has gone in towards addressing the toxic drug supply, which is substantially more than the previous government that had only allocated at the start of its tenure $30 million to treatment and reduced that by 2/3 by the time they exited their governing term. So from 30 million down to 10 million, this government has put in 1 billion in addition to the 25 billion that is part of the 200 billion that is going towards healthcare today. So I would hardly say that we've taken our foot off the gas, and I would reject that premise.
Well, I would reject that answer, because I'll say this, Minister, you've spent less than 1% of what you spent, your government, in terms of responding to the COVID-19 crisis. And if you want to compare yourself to the Harper government, go right ahead. But we know they didn't take this issue seriously. So, Minister, I'm going to get to another question here. In terms of, we come out of the pandemic and we're now dealing with the cost of living crisis, greater access to mental health supports, housing's included, and it's needed more than ever. I've talked to your predecessor about the important need for funding for tiny homes, for example, so that we get people off the street into safe, secure housing, so that when they're ready for help, we can meet them where they're at. They can't get help when people are homeless. So how is your department working with the Minister of Housing to secure supportive and transitional housing? And we know the provinces will be there should there be capital funding for tiny homes, for example, and housing.
Thank you for the question, and I couldn't agree with you more, which is why we began to convene my counterparts on a quarterly basis on key issues that overlap and between departments. And one of the important conversations we had in our first quarterly meeting was exactly about that, of how were my provincial counterparts working with their local municipalities on the housing funding proposals that the Minister of Housing is negotiating jurisdiction by jurisdiction. We continue to work across departments to highlight that there needs to be a prioritization of complex need housing, including for those who are struggling with substances. We encourage municipalities, we'll be meeting with the FCM in the coming months also to ensure that avenues are open to include in their proposals to the federal government in the rapid housing strategy and housing strategy, that they are including those considerations in their funding grants through the federal government.
Thank you, Mr. Johns. Thank you, Minister. Next, Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, Mr. Chair, and I want to lend my voice in congratulating Dr. Lewis on his retirement. Minister, are you aware of government-funded so-called safe supply pills ending up in the hands of gangs?
I'm aware that the RCMP is actively involved in seizures across the country.
Fantastic. So you've said in this committee, you've said on Twitter that you're not concerned about the diversion because it's not widespread. So can you define to us what exactly widespread is?
Look at it in terms of what prescriptions are out and who is using them across the country to get a better understanding of where diversion may be happening.
Thanks. So I guess I've done a little bit of math. So with about 4,500 people on safe supply programs in British Columbia, each receiving approximately 30 pills a day, that's about 50 million pills a year. So how many of those pills diverted a year would be acceptable to be diverted as far as you're concerned? To make it widespread enough.
As I said, well, let's look at some other numbers. There are approximately 115,000 people in BC with opioid use disorder, and 86% of hydromorphone pills distributed around the country are actually to cancer patients and those who suffer with arthritis.
Minister, these pills are being diverted into the hands of gangs who are profiting off the death of Canadians. So what specific concrete measures are you and your ministry taking to ensure that pills, and I don't care whether they're safe supply pills or other pills, are doing to not be diverted, causing further addiction and crime in our communities?
So as the RCMP Commissioner, John Brewer, said, there's currently no evidence to support a widespread diversion of safe supply drugs, but about 14% of the total number of hydromorphone pills that are prescribed around the country are going to safer supply.
Okay, so this sounds like doublespeak to me, because we have Prince George RCMP.
No, they're actually the data and the numbers. It's not doublespeak.
The Prince George RCMP have stated that they've found hydromorphone that was from safe supply programs in a recent drug bust. So the BC top police, probably from political interference, was told to downplay it and say that there isn't widespread diversion happening. But if it's happening in Prince George, it's happening on Vancouver Island, it's happening in communities all across Canada that have these so-called safe supply programs. So what specific actions are you taking with your SUAP grants to ensure that no diversion is happening from these programs?
So first of all, I would say it's highly irresponsible to insinuate that there's political interference in law enforcement. Law enforcement does its job as it should without politicians getting involved, such as politicians not directing what is our medical directives. But as Jen Sachs answered earlier, in the steps that are being taken on the federal level for our projects, we've enhanced protocols for patient screening, efforts to better match drugs to patient tolerance. We've put in risk-based protocols to assess patient eligibility on take-home dosing. We have patient monitoring protocols in place. Actions to address diversion have included switching to observed dosing, transferring to different support services, or removing those who should not be in those programs.
Okay, so if those items aren't happening, will the lack of those things happening that you guys have just identified mean that you will not fund programs through SUAP?
That is correct.
Okay, so if there is evidence of diversion that is happening from SUAP program funded so-called safe supply programs, that funding will cease, and will it cease immediately?
At this point in time, the protocol measures have been put in place and they are constantly being monitored.
So how soon after diversion is found to be happening from those exact safe supply programs that your government is funding, will your government act to cut off that fund?
I'll defer to Jen Sachs.
At this point in time, what we are doing is working with all the projects to ensure that they are putting in those robust set of safeguards and measures. And we will be closely, there will be regular reporting. We have open line of communication with the projects, with law enforcement, all of these. And so we will be regularly monitoring and then making adjustments as needed. Informed by
I
that
think it's
evidence.
really sad for Canadians that the government refuses to give an answer as to what they would do and how quickly they would act if they found that something absolutely illegal was happening, to actually act, to cut off funding, to save the lives of Canadians. I think it's absolutely shameful that they're allowing gangs to profit off the death of Canadians that they are funding.
Care to take a few minutes to respond to that, or shall we move on? All right. Maybe the next person will afford you that opportunity. Mr. Pawlowski, Dr. Pawlowski, please, for 5 minutes.
First of all, I'd like to table a motion, give notice of motion, that pursuant to Standing Order 1082, the committee undertake a study of the treatment and prevention of cancer in Canada, including the state of current research on diagnosis and treatment of cancer, that the committee allocate up to 8 meetings to this study, that the committee report its findings and recommendations to the House, and that pursuant to Standing Order 109, the government table a comprehensive response to the report. I wasn't going to go here, but I've heard the testimony, and Jennifer, I know you're locked in conversation there, but you did talk about diversion and safeguards for diversion. So I don't want to make my 30-plus years of being a doctor totally useless. I kind of listened to the safeguards, and I had some questions. So you say screening of patients. I've been doing this for 35 years. When I started, I used to think I could tell who was reliable and who wasn't. And I remember literally seeing a nun who came in and wanting, I don't know, she wanted benzodiazepines or narcotics and stuff. And I said, oh, of course, she's a nun. Like, I'll give her a prescription. She's honest. And then a guy comes in with a lot of tattoos and a kind of a muscle shirt, and you say, well, I ain't giving him to him because he's unreliable. And in the 35 years since, I cannot figure out beforehand who's going to be reliable and who could possibly be selling it. Even I would say if you get to know your patients well, you don't know. Even the grannies, these little grannies that come to you and say it's because of their bad arthritis, you don't know that they're not selling it. And I've heard it from the cops. They know places where the old people go and they sell it to dealers. As to an agreement, I mean, if somebody's going to sell the drugs, I don't think you're going to trust them to make an agreement with you and sign a paper and, okay, you can trust them now. As to the regular urine tests, those tests are positive, negative. I've seen those. I work in a clinic that does them. It's positive or negative. So if you give somebody 8 Dilaudid tablets to take home, all they have to do is take 1. Go sell the other 7. Your urine's going to be positive one way or the other, right? So that wouldn't seem to me all that reliable. I think you had some other safeguards. I think there was protocol for dealing when diversion occurs, but do you have other protocols? And let me just mention briefly in passing, I think the British Columbia Officer of Health, in reviewing the safe supply situation, actually recommended that the fallback position be observed treatment, I'm not sure what the recommendation is with reserve treatment. Yaris repeatedly mentioned Switzerland. Switzerland, all the studies with HAT, heroin assisted treatment, those are all observed treatments. And I've certainly, in talking to a lot of experts in addictions, they've been looking for the same thing, which is observed treatment, possibly with intravenous fentanyl or oxycodone. But it doesn't seem like there's funding there at the moment for it. Is there contemplation of providing more funding? In fact, some of the addiction people I talked to, they said the pills, going home with the pills was kind of the poor man's choice because they didn't have the money to do observed treatment, which is where the evidence is for. So I wonder, like, I got off topic. If there's more safeguards, you can talk about that. But also, how about in what's the plan in terms of the possibility with the real hardcore addicts, as in Switzerland, that they provide directly observed treatment rather than pills going home?
So a couple of points. Thanks for that question. I think it's important to note that it's a suite of measures. It's not one or the other, so it's a suite of measures. Part of those measures include absolutely having the capacity to have witness dosing based on assessment or any indication that there may be diversion, includes random and regular urine drug screening. As part of these projects, some of it is witness dosing. It is not all just hydromorphone tablets. There are some injectable programs. There are a variety of different medications. We are also requiring that projects provide a range of kind of backbone medications so that you could reduce the amount of additional kind of safer supply or prescribed alternatives that a healthcare professional may want to prescribe to a patient. So it's a range of measures that are being taken. There must be the capacity to witness depending on the assessment and working with them. There are projects that absolutely have injectable and other observed dosing. I will note in Switzerland that with heroin-assisted treatment, and I'll pass it on to my associate deputy who is just there, but they do have witness as well as carries in that case. And all of this is being undertaken with regular monitoring, reporting, and evaluation that is being undertaken that will inform our work.
If I may, Chair, the only points I would add is, I mean, to your point, I mean, really what we've done as a part of our efforts to really take a close look at projects, understand the risks, is really through consultations with, those in, experts in addiction medicine, understand what is the top tier, what are the top threshold of safeguards that can be put in place when dealing with substitution therapy of any kind, when a narcotic is involved, and then apply those in the context of these projects. And to the earlier question about, we would be prepared to move very, very quickly where we see, where we encounter evidence of systemic harm. And yes, just on the point of Switzerland, we're very
Thank you.
Very interested in the work being done in Switzerland with their heroin-assisted treatment. They do 7-day carries now as a part of an unsupervised dosing program, which we've studied very, very carefully to try to take as much from their experience as we can and apply it in Canada.
Thank you. Monsieur Thériault, pour 2 minutes et demie.
Mr. Thériault, 2.5 minutes. So, yet again, a technical question. During the government's November economic statement, the Minister of Finance announced an intention to remove GST and such taxes on counseling services. And in Quebec, people are wondering they will benefit from the removal of these taxes. Educators are asking whether they too will be covered by this. And if you can't answer, could you provide us with a written answer? Thank you. Honourable Minister, in the RCMP drug seizure, you tell us that we can't tell where this came from, but what can you tell us about the source of these seized drugs, prescription drugs? How come all this is in the hands of organized crime? Thank you for your question.
By making sure that we are all on the same page about diversion. Diversion is illegal. It is illegal in all contexts in terms of all drugs and all medication. And I'd say that diversion happens with pain medication, ADHD, anxiety prescriptions, and so on and so forth. And the question that we're always asking is, how much diversion are you willing to accept? Because it happens in all of these spaces with all of these prescriptions and in many different scenarios. And we aren't stopping healthcare provision in those instances. So if we are looking at hydromorphone and prescribed alternative within the same context of healthcare provision, then we have to look at it through the same lens.
Bon, je comprends que vous pouvez...
All right. I understand that you have worked up these principles that you've told us of today, but I certainly hope this is something that you'll look into in greater depth. It would be important to do so. Probably the RCMP must carry out its investigations and come up with evidence and present it. I understand the legal constraints on information sharing, but at least tell us that you will get answers and that you're looking for answers, because this sheds great discredit on the entire program of harm reduction when you see news to this effect that can be, used to support various narratives. So do you agree? Will you make efforts to get back to us on this matter and tell us what you will have learned about this, and do you have any specific concerns to ensure that follow-up is carried out, yourselves involved?
Thank you. And as I've said previously in this committee, I take, as does the department, takes diversion very seriously, which is why we began with the protocol review that we did with our programs, and we will continue to do that work. And the department can provide you with a briefing on what we are doing in working collaboration with law enforcement.
Thank you, Minister. Last round of questions for this panel will come from Mr. Johns. The next 2.5 minutes, please.
Well, thank you, Minister. Minister, before I get into my question, in terms of Wellness Together ending, this deeply concerns me because I want to know what's going to fill that need going forward. And also the bilats, they're not good enough. We saw PEI. They said they're spending zero money when it goes to mental health, and I hope you'll work with me on this. But I want to get to, Minister, we heard the Conservatives take on the attack on Dr. Sereda earlier in committee. And Dr. Sereda posted on X in a response to Adam Zivo, who's a freelance writer and weekly columnist at the National Post. He published the small city where she lives not once, but 3 times. She cited that she didn't feel safe in London, Ontario, due to a history of domestic violence. She's moved numerous times, eventually had to move to a new location to be safe. She protects the info where she lives very closely. Nothing is available online. She said her address is actually very hard and difficult to, not very easy to find. Others have joined in and mentioned the town where she is and where her kids are online. Now, Dr. Sereda contacted Adam Zivo. She said she moved to be safe from domestic violence, and his posts have made her feel unsafe. His response, it's in the public interest to know where she lives because she doesn't live in London, where she prescribes safer supply. So, he says that public interest is as important as her privacy despite her safety risks. Police contacted Adam Zivo. He apologized and said he understands he shouldn't have posted it, but he still refuses to remove the post. He has a pattern of attacking and slandering Dr. Sereda. Dr. Sereda has experienced harassment, vulgarity, and more from his followers. And even after he knew about the safety risk, he posted it again, even saying her address is easy to find. Sounds like a call to action challenging his followers to find her. Not something you say to a woman who has asked you 3 times to take down her safety. So I'm asking you, Minister, what are you going to do to protect the safety of these doctors and medical health professionals? And I'm hoping this committee is actually going to write the National Post. But also imagine if this was on the flip side. If this was the media and people started posting addresses of the editor of the National Post or staff at the National Post. This is unacceptable. What are you going to do about it to protect these health professionals?
Thank you for the questions. I'll start with the first question with regards to Wellness Together. During the pandemic, the Wellness Together
I'm looking for an answer on Dr. Sereda because of time. Are you going to put forward legislation, or what are you going to do to protect this doctor?
Okay,
and all doctors and medical health
You're also out of time,
professionals in this
Mr.
area.
John, so just allow her a bit of a short response, please.
As in all cases such as this, we would work with local law enforcement to ensure anyone's safety of healthcare providers. We've actually passed legislation to ensure the protection of healthcare providers.
Can I ask for a response in writing, Mr. Chair, from the minister, or how she's going to respond to my question?
You can ask for a response, and you just have. Thank you. That concludes the rounds of questions for this panel. Colleagues, I would ask you to remain as we bid goodbye to the witnesses for one brief matter that we need to touch on before we wrap up. Minister, and to your officials, thank you so much for being with us and for being so patient in answering our questions. I hope this is the most challenging thing that you have to do all day. Thank you very much. You're welcome to stay, but you're free to leave. Colleagues, before we adjourn, I have something time-sensitive that I want to raise. Normally, this would be done in camera, but it is on the subject of the planned committee travel in the month of April. There have been concerns expressed about the availability of members of Parliament to make that trip, and so I guess my question for you is whether it is the will of the committee to conduct the trip as we had discussed during the break week in April, or whether it would be your preference to do it during the break week in May. And I think Dr. Ellis.
Point of order.
Yep.
Mr. Chair, I move that we go in camera for this discussion.
That is an excellent suggestion, except that we are kind of trading on the goodwill of our resource folks and our translators now, and that would probably test the limits of that goodwill.
If it takes 2 minutes to move in camera to have this conversation, then probably can take 5 minutes.
Can we have 7 minutes?
Because it's standard practice to discuss this.
They're right. This is something that would normally be done in camera. Okay, we're gonna suspend 1 minute and see if this is going to be possible. Otherwise, we'll be entertaining a motion for adjournment. It's adopted. We are now suspended for 2 minutes to allow for in camera.